How to treat and cure dermatitis. Treatment can help most people manage their contact dermatitis, and some people may find that their symptoms clear up entirely. There are several ways to treat contact dermatitis, including reducing your exposure to irritants, avoiding allergens, emollients, topical corticosteroids, oral corticosteroids. These are explained below. Avoiding the cause. One of the most important steps in treating contact dermatitis is identifying and avoiding the allergens or irritants that affect you. If you can successfully avoid or reduce your exposure to the cause, you shouldn't experience any symptoms. It's not always easy to avoid the irritants or allergens that affect you, but your GP or dermatologist, a specialist in treating skin conditions, can find ways to minimize your contact with them. If you're exposed to irritants as part of your job, wear adequate protective clothing to minimize any contact. Tell your employer about your condition, so they can help you avoid the causes as much as possible. Read more about preventing contact dermatitis. Emollients. Emollients are moisturizing treatments applied directly to the skin to reduce water loss and cover it with a protective film. They are often used to help manage dry or scaly skin conditions such as eczema. Choice of emollient. Several different emollients are available. You may need to try a few to find one that works for you. You may also be advised to use a mix of emollients, such as an ointment for very dry skin, a cream or lotion for less dry skin, an emollient to use instead of soap, an emollient to add to bath water or use in the shower, one emollient to use on your face and hands, and a different one to use on your body. The difference between lotions, creams and ointments is the amount of oil that they contain. Ointments contain the most oil, so they can be quite greasy, but are the most effective at keeping moisture in the skin. Lotions contain the least amount of oil, so are not greasy, but can be less effective. Creams are somewhere in between. Creams and lotions tend to be more suitable for red, inflamed, swollen areas of skin. Ointments are more suitable for areas of dry skin that are not inflamed. If you have been using a particular emollient for some time, it may eventually become less effective or may start to irritate your skin. If this is the case, your GP can prescribe another product. How to use emollients. Use your emollient frequently and in large amounts. Many people find it helpful to keep separate supplies of emollients at work or school. To apply the emollient, use a large amount. Don't rub it in, instead, smooth it into the skin in the same direction that the hair grows. For very dry skin, apply the emollient every 2 to 3 hours. After a bath or shower, gently dry the skin and then immediately apply the emollient while the skin is still moist. If you're exposed to irritants at work that cause your contact dermatitis, make sure you apply emollients regularly during and after work. Don't share emollients with other people. Side effects. Occasionally, some emollients can irritate the skin. If you have contact dermatitis, your skin will be sensitive and can sometimes react to certain ingredients, such as perfume and over-the-counter emollients. If your skin reacts to the emollient, stop using it and speak to your GP, who can recommend an alternative product. Be aware that some emollients contain paraffin and can be a fire hazard, so should not be used near a naked flame. Emollients added to bath water can make your bath very slippery, so take care getting in and out of the bath. Topical corticosteroids. If your skin is very red, sore and inflamed, your GP may prescribe a topical corticosteroid that is applied directly to your skin, which can quickly reduce the inflammation. You may be concerned about using medication that contains steroids. However, corticosteroids are not the same as anabolic steroids, which are sometimes used by bodybuilders and athletes. When used as instructed by your pharmacist or doctor, corticosteroids are a safe and effective treatment for contact dermatitis. Choice of topical corticosteroid. Different strengths of topical corticosteroids can be prescribed, depending on the severity of your contact dermatitis and where the affected skin is. You may be prescribed a stronger topical corticosteroid for short-term use in severe contact dermatitis. A weaker topical corticosteroid if the eczema is mild. A weaker topical corticosteroid for use on your face, genitals or in the creases of your joints, such as your elbows, as your skin is thinner in these areas. A stronger topical corticosteroid to use on your palms and the soles of your feet, as the skin is thicker here. Use topical corticosteroids. When using corticosteroids, apply the treatment in a thin layer to all the affected areas. Unless instructed otherwise by your doctor, follow the directions on the patient information leaflet that comes with your medication. This will give details of how much to apply. During an episode of severe contact dermatitis, do not apply the corticosteroid more than twice a day. Most people will only have to apply it once a day. You should apply your emollient first and wait around 30 minutes before applying the topical corticosteroid. The medication will usually start to have an effect within a few days. Speak to your GP if you have been using a topical corticosteroid and your symptoms have not improved. Side effects. Topical corticosteroids may cause a mild and short-lived burning or stinging sensation as you apply them. In some cases, they may also cause thinning of the skin, changes in skin color, acne, spots, increased hair growth. Most of these side effects will improve once treatment stops. Generally, using a stronger topical corticosteroid or using a large amount of topical corticosteroid will increase your risk of getting side effects. For this reason, you should use the weakest and smallest amount possible to control your symptoms. If you have a severe episode of contact dermatitis and it covers a large area of your skin, your doctor may prescribe corticosteroid tablets. You may be prescribed corticosteroid tablets to take for 5 to 7 days. Depending on how effective this is, your dose may then be gradually reduced over 2 to 3 weeks. If corticosteroid tablets are taken often or for a long time, they can cause a number of side effects, such as reduced growth rate in children, high blood pressure, hypertension, osteoporosis, brittle bones, diabetes. For this reason, your doctor is unlikely to prescribe repeat courses of corticosteroid tablets without referring you to a specialist. Further treatments. If the treatments prescribed by your GP are not successfully controlling your symptoms, they may refer you for assessment and treatment by a dermatologist. Further treatments that may be available from your dermatologist include phototherapy, where the affected area of skin is exposed to ultraviolet, UV, light to help improve its appearance. Immunosuppressant therapy, medicines that reduce inflammation by suppressing your immune system. Allotratinone, a type of oral medication licensed for severe eczema affecting the hands. Complementary therapies. Some people may choose to use complementary therapies for contact dermatitis, such as food supplements or herbal remedies, but there is often a lack of evidence to show they are effective in treating the condition. If you are thinking about using a complementary therapy, speak to your GP first to make sure the therapy is safe for you to use. You should continue to use any other treatments prescribed by your GP. Atopic dermatitis can be persistent. You may need to try various treatments over months or years to control it. And even if you respond to treatment, your signs and symptoms may return, flare. It's important to recognize the condition early so you can start treatment. If regular moisturizing and other self-care steps don't help, your doctor may suggest the following treatments and drugs. Medications. Creams that control itching and inflammation. Your doctor may prescribe a corticosteroid cream or ointment. Talk with your doctor before using any topical corticosteroid. Overuse of this drug may cause skin irritation or discoloration, thinning of the skin, infections, and stretch marks. Creams that help repair the skin. Drugs called calcineurin inhibitors affect your immune system. Applied to the skin, they help maintain normal skin, control itching and reduce flares of atopic dermatitis. Due to possible side effects, these prescription-only drugs are used only when other treatments have failed or if someone can't tolerate other treatments. They are approved for children older than 2 and for adults. Drugs to fight infection. You may need antibiotics if you have a bacterial skin infection or an open sore or cracked skin caused by scratching. Your doctor may recommend taking oral antibiotics for a short time to treat an infection. Or he or she may suggest you take it for a longer time to reduce bacteria on your skin and to prevent another infection. Oral anti-itch drugs. If itching is severe, oral antihistamines may help. Diphenhydramine can make you sleepy and may be especially helpful at bedtime. Oral or injected drugs that control inflammation. For more severe cases, your doctor may prescribe oral corticosteroids such as prednisone, or an injected corticosteroid. These drugs are effective but can't be used long-term because of potential serious side effects. Continue moisturizing and using other self-care remedies to prevent a flare-up after you stop taking the corticosteroids. Therapies. Wet dressings. An effective, intensive treatment for severe atopic dermatitis involves wrapping the affected area with topical corticosteroids and wet bandages. It has proven to control signs and symptoms within hours to days. Sometimes it is done in a hospital because it's labor-intensive and requires nursing expertise. Or, ask your doctor about learning how to do this technique at home. Light therapy. The simplest form of light therapy, phototherapy, involves exposing your skin to controlled amounts of natural sunlight. Other forms use artificial ultraviolet A, UVA, and narrowband UVB either alone or with medications. Though effective, long-term light therapy has harmful effects, including premature skin aging and an increased risk of skin cancer. For these reasons, phototherapy is not used for infants and young children. Talk with your doctor about the pros and cons of light therapy in your situation. Treatment for stress. Counseling may help children and young adults who are extremely embarrassed or frustrated by their skin condition. Relaxation, behavior modification or biofeedback. These approaches may help you with habitual scratching,